Hello, everyone. My name is Marcos Rojas. I'm a PhD student at the Graduate School of Education at Stanford University. And today I'm going to present to you this app called Clinical Mind AI, improving clinical reasoning using generative AI. We know in medical education that the most important skill for a physician is clinical reasoning. Here in this mental process, we take into consideration information from the medical history, the physical examination, and the medical tests to arrive to an initial working diagnosis. But in medical education, we have some challenges when it comes to teach and learn this important skill. Here we have 4 examples of the most common assessment tools that we use to measure this mental process in medical students. Here you have 3 examples: multiple choice question, problem-solving template, and the script concordant test. These 3 options have a common challenge, which is that they give to the medical student a summary of the patient history, physical examination, and the medical tests so they can think about the diagnosis of the patient. There is a problem about authenticity because in real life, students will be the ones who have to collect that information from the patient. Then we have a 4th option here, the standardized patient, where we have a paid actor that acts as the patient so students can collect that information and the information they need from this actor, which is the patient in this case, and then they have to think about the diagnosis. So they collect the information and this solves the problem about authenticity. But here now we have a new challenge, which is the costs, because this is very expensive and also difficult to scale. We also have some evidence that approximately 80% of the diagnosis can be made based on patient history alone, and also that the main differences between students and experts are in medical history of patients in terms of problem-solving practices. So when we think about the main challenges that medical students face when developing their own clinical reasoning, medical history is the main challenge. So now you have information that clinical reasoning is the most important skill for a physician, that we have some challenges in teaching and learning this important skill, and also that clinical history is going to be the main challenge for medical students. So we came to this idea that is both authentic and affordable, that we can improve clinical reasoning during patient interviews by using generative AI as a simulated patient, facilitating targeted and deliberate practice. We call this solution Clinical Mind AI. In this app, the medical teacher provides the clinical case according to the learning outcomes of the class, for example, or even the epidemiology of the country. And then the medical student interacts with this clinical case to then receive feedback about the clinical reasoning skills and the working diagnosis. And also the medical teacher receives a summary of the student's performance. We are now finishing the prototype of the platform to then test the platform with medical experts, medical teachers, and medical students. Then we're going to improve the platform and prompt after these tests to then run our RCT with medical students, some of them using Clinical Mind AI versus another group using the traditional clinical simulation. And then finally, we're going to share this app with the world. Thank you very much for your attention.